going into hospital, it can feel like such a big call, and a lot of families feel a bit nervous about how to know when to go into hospital. When is it time? So one way that can kind of guide you is you want to be doing 3 to 4 strong contractions in a 10-minute period. Remembering from the established labor video that this is when you're in established labor, when you're having rhythmic, strong, regular contractions, roughly 3 to 4, 10 and 10 minutes, okay? And we want to be thinking about our oxytocin levels being really strong here, because what happens when we go into hospital is that generally we do get a bit of an adrenaline rush, because it's, you know, bright lights, it's foreign people talking, it's, you know, maybe traffic on the way in, all of that kind of thing, car park, walking in, you know, there's definitely an adrenaline rush that happens. And so what can happen if you go in too early is that adrenaline rush can knock off your contractions, reduce your oxytocin, and then you're sent home, or you're facing intervention. So we really want to be making sure that you feel like your oxytocin levels are really strong, that adrenaline rush is not going to knock them off. And the other thing is trying to reduce that amount of adrenaline as much as possible. So maybe doing things like sunnies on, headphones in, you know, trying to reduce the amount of talking that you know, are doing with staff and whatnot. When you get into the birth room, trying to set up your space as quickly as possible. If you, when you go into hospital, have to go into an assessment center first before you get into the birth room, don't be afraid to say, you know, can we turn the lights off? Or I don't really want to lay on the bed, you know, can I set up on a birth ball? Because we know laying on the bed, it's going to feel more painful, then you're more likely going to kind of, you know, need maybe potentially pain relief, things like that. So really think about this and be proactive in reducing that adrenaline and keeping your oxytocin and endorphin levels high. So if it's your first baby, you know, if all is well, see if you can do 3 to 4 strong contractions for at least a couple of hours at home. If you've had a baby before, be guided by what happened the first time, you know, how quick that was, how long since you've had that baby before, because we know that generally subsequent births, you know, will progress quicker. So really have a chat about your individual circumstance with your midwife or doctor about when you should come in if you've had a baby before. But something else is be guided by how quick things are happening. If this has been a really slow burn for you and, you know, you feel like things are progressing really slowly, then give yourself that more time. But if you've kind of, you know, woken up and gone from 0 to 50 really quick, then you're probably going to go from 50 to 100 really quick too. So help that to kind of guide your timing around when you go in as well. And it's also just really important to note that you should always go in if you're ever concerned about baby's movements, if your waters are broken, if you're bleeding, or if you're not coping, or you've got any other concerns. You know, these are not hard and fast rules. You can always go in sooner if you feel like that there is a need to. But otherwise, if all's well, think about what you're going into hospital for. Do you really feel like that baby is going to be born soon? Are you going in for pain relief? You know, because labor and birth, it doesn't stop. It's not someone else's problem when you get into hospital. You've still got to do labor and birth. So if you're coping well at home, your endorphins are working well at home, and there's no obvious reason to rush in, then enjoy. And your body will tell you, and you will feel that need that, oh yeah, now it's time to go in. So what is informed consent and why does it matter? Well, as healthcare providers, if we are coming to you with a recommendation about your care, we should be giving you the opportunity to really understand all of the risks and the benefits about what that intervention would involve, and provide you with that information so that you can then either accept or decline. And this conversation should be done without any coercion at all. Okay, so legally, we cannot do anything to you without your consent. It is otherwise assault. However, what we know is that a lot of women are told that they need a cesarean or an induction, and they don't even really know why. They don't feel like that they can ask the questions or that they can say no. We hear a lot of women say, can I say no to that, or am I allowed to do this? You are allowed to do whatever you like with your body. And it is up to us as healthcare providers to, like I said, provide recommendations backed with the risks and the benefits of those recommendations. And then you make the best decision about you and your baby. Okay. Now, the reason why this is important is because we know 1 in 3 women are walking away from their birth with birth trauma and 1 in 10 with PTSD. And this is directly linked to whether or not that woman was involved in the decision-making process, whether she felt like she was the one in control and had the power over what happened to her body and her baby. And that when women are treated like they're just another woman on the table, a piece of meat, things happen to them, and they don't know why, they weren't told what was going on, this is what causes birth trauma and PTSD, regardless of whether you have a cesarean section or a normal birth. Okay, so really, really important to maintain power and control over what happens to you in your pregnancy and your labor and birth, because you are going to make the best decision. Okay, so a little way that you can do this is using what we call the BRAIN acronym. Now, the BRAIN acronym really helps us to unpack any recommendations. So the first step is asking, well, what are the benefits? And that's pretty straightforward. What doesn't get spoken about a lot is, what are the risks? So if someone's recommending an induction, what are the risks with the induction? What's an alternative? There's always an alternative. So really unpacking with your healthcare provider, okay, I hear your concern, but I'm not comfortable with the risks associated with that. What's a different route that we could take to ensure safety? What does your intuition say? Really, we see this all the time in practice, that pregnant mums, they really have this strong intuition about what's going on for them and their baby. And that might be that they feel actually everything is fine and I feel safe and baby's moving really well. Or it could be a concern that they have and they're not comfortable to leave the hospital. And so following your gut intuition is really, really important. And then the last one is N, what if you did nothing? Okay, so if you're faced with a decision in the antenatal period, definitely don't feel like you have to consent right then and there. Take some time to think about it, have a chat to your support people, have a look online, if you can, get a second opinion. And if it's something that's occurring in labor and birth and you ask for more time, then this can really help you unpack whether this is an urgent situation or not. Because if it really is urgent, the doctors and the midwives are going to say to you, if we don't act now, there is a strong chance of serious harm. But if you say, look, can we wait a couple of hours and see what happens? And they say, well, yeah, that should be okay, let's watch and wait. Then you probably have time to do that. And who knows what can happen in that time, okay? So using the BRAIN acronym and withholding power and control over your body and the decision-making process in your pregnancy and birth is so, so important at decreasing that risk of birth trauma and PTSD. So to birth plan or not birth plan, we get a lot of feedback as midwives that women don't want to do a birth plan because they don't want to be disappointed because things can go wrong. And absolutely this is true. So things can go a little bit off center or off course than what we position. Birth is not something we can always plan for specifically. And so maybe birth planning is not the right word. maybe the best thing would be to call it birth preparation. Because what we do know, like we discussed in the informed consent portion, is that when we're making informed decisions, that we're less likely to suffer things like birth trauma and PTSD. Another way I like to think about it is that if we were to go and sit the most important exam of our life, and someone said to us, oh, don't bother studying because you don't know what questions are going to be on there, then you probably wouldn't do very well. But if you've done some study of all the different topics that could be on there, then we know that you're more likely to achieve success. And this is absolutely the same when we give birth. Okay, we know that you have the power to do things that can dramatically alter the course of your labor and birth and therefore postpartum experience. But if you don't know those things, then you can't do them. Okay. The other important thing to remember is that for most women, you will be looked after in your labor and birth by somebody that you don't know, a midwife or a doctor that you don't know. Even in the private health system, when you've got a private obstetrician, the midwives on shift, you likely won't know them very well at all, and then the doctor just comes in at the end for the birth. Okay, so think of this as a guide to somebody that you've never met before as to how best to look after you in the most important moments of your life. What happens to you when you give birth will stay with you for the rest of your life, and it will set the course like a pebble dropped into water. It sets off a ripple effect as to what will then happen to you and your baby for the rest of your journey. Okay, so it's such an important period of time. So think of it as a guide to a person you don't know of what's important to you, how you want to be looked after, and so that they can provide you with individualized care. Otherwise, they will do their absolute best to provide you with the standard care that we provide to everyone. But you're not the same as everyone else. You are you, and you have your own unique individual needs, okay? So please take the time. And so it doesn't need to be long and drawn out. It can be pictures or it can be bullet points. And actually, I think it's best when it's really succinct and clear and easy to read. Okay, so really important to take the time to sit down, talk with your birth support people, and come up with that guide. And then make sure that you hand it to the people who are looking after you when you first arrive into hospital, so that they know how to best look after you, and you can decrease your risk of birth trauma and PTSD and increase your chance of having a beautiful, empowering birthing experience.